Mtazamaji, karibu kwenye matangazo haya ambayo tunakuletea mubashara kutoka kaunti ya Garissa. Mimi ni Mashirima Kapombe na mchana huu tunakuletea mdahalo kuhusiana na masuala kadha wa kadha yanayohusu masuala ya majanga, namna ya kuyatabiri na mikakati inayochukuliwa mara tu majanga haya yanapotokea, na ni majanga yanayosababishwa na mabadiliko ya hali ya anga. Na matangazo haya tunakuletea kwa hisani ya Asal Humanitarian Network ambayo imeleta pamoja kaunti 7 ambao wamejumuika hapa katika siku 3 zilizopita, na kaunti hizi ni kaunti za Garissa, Isiolo, Tana River, Marsabit, Samburu, Mandera na Wajir, na wamefanya hivyo kwa ushirikiano na mashirika mengine ambayo yanajumuisha UNICEF, WFP, Save the Children, Workshop Fund by Australian Aid, ECHO and Oxfam in Kenya. And as I said earlier, this discussion is on disaster preparedness, response, recovery and resilience in Kenya's ASALs. And here on the stage we have our panelists who we will engage in the next hour or so, and I would like to introduce them. From my right here is Mohamed Dubo, who's the Director Special Programs, Donor Coordination and Partnerships from Garissa County. Next to him is Abarea Roba, who's the County Coordinator, Kenya Red Cross from Tana River. Third is Bernard Nyatuga, who's the Humanitarian Director from WFP. And last but not least is Moses Emalu, who's the Humanitarian Manager for Save the Children. And as I said, we are not alone here. We have an audience who Marianne Nyambura will also engage. And those who are represented here are those from the counties that I mentioned earlier in the introduction. But first, a snippet of the conversations that we have had here for the past 3 days. Garissa County has played host to 7 counties positioned in arid and semi-arid lands for a discussion that is in line with climatic seasons that bring out hazards that more often turn to disasters.
And we have a lot to do when we get back to our counties.
The 3-day workshop, led by the Garissa and Isiolo humanitarian hubs under the theme Enhancing Disaster Preparedness Response, Recovery and Resilience in Kenya's ASALs, brought to the fore early warning systems used by communities and governments.
Tunatabiri na nyota. Kuna nyota ambazo zikionekana, hizo nyota huwa zinaelezea kwamba mwaka huu kutakuwa na mafuriko. Vile vile tunamesha hizi mawingu. Mawingu kama yatakuwa yanatanda alafu hayanyeshi upande huu wetu, yanakuwa yanapita, huwa tunajua tu nyanja za juu kutanyesha na mafuriko yanaweza kuja kwa wingi. Na vile vile joto likiwa lingi sana na kuwa ni namna hiyo, tunajua tu kuna mafuriko. Bado huwa tunaangalia ndege. Kuna ndege huwa wanahama kutoka sehemu zingine wakija sehemu zingine. Sasa ndege kama hawa tukiwaona kwa wingi wakifuatana, wakipeperuka kwa chini wakifuata mtotana, tunajua tu kwa wametoka upande wa juu wanaenda upande hii, tunajua obvious hapo kuna mafuriko yatakuja.
The Kenya Meteorological Department shared insights on when early warnings are given and the expectation for actors to respond and implement measures to prevent a disaster.
And in Garissa we have the river gauge level, which is monitored. And we also have to monitor the forecast of rainfall at the catchment area, that is Mount Kenya, Aberdares and Makueni. So if the water level reaches 3.5, that is the alert level. Once we obtain the alert level, we still monitor the catchment area rainfall performance. If we are going to receive more rainfall, then it means we are going to have the rise in water level. If it reaches 4 meters, then most of the areas of Garissa starts flooding.
Stakeholders that included community members reiterated the need for early actions to prevent significant losses that makes it harder for recovery.
Kama serikali wakisema na tukitoka na mafuriko yaje, huwa tumejiokoa. Na sana sana hasa kwa upande huu wa ziwani ni kwamba tukisha kutoka, sana sana huwa mafuriko hayo ambayo yanazungumzwa huwa yana strike usiku. Wakati wewe unajipanga uende utayarishe sehemu ndio upeleke familia, mvua ama maji yanakuja, kwa sababu si mvua huku kwetu. Huwa sana sana ni maji ambayo yanakuja na mtotana, yanakuja na vamia, inakuwa inchi inakuwa ni maji yote. Sasa hapo inabidi wewe ukimbie na watoto. Kama ni mbuzi utaziacha, kama ni mabata yako, kama ni kuku, kama ni mbuzi zako utawacha, wataenda na maji, lakini unachukua tu wale roho unazitoa hizi watoto wako na mke wako unamtoa nje. Kitambo utarudi kule tayari kila kitu kimeshakuwa washed out.
And internally we also put implementation plans for all the sections like health, water, sanitation and nutrition, education, all that. And these measures have, together with the county government, through the county steering group and also the special programs and the county commissioner office, this has benefited the community, one in moving to higher areas, higher ground from where the lower ground, when during the El Nino, for example, when floods came. And then it also supported the partners to ensure that there is coordinated approach. And this has supported and ensured that now the response and also the response for these floods and El Nino was well coordinated and was done in time.
Despite interventions salvaging the situation when climate disasters occur, laws in both Parliament and county assemblies still hang in the balance.
Be an act. The act needs to have a funding mechanism that is very clear so that then we can be very sure that the mechanism is there. Without a proper legal framework, then we are not clear of why the financing should be there. Nationally, we are supposed to be having 2% of the budgets going to disaster management. How timely that will come needs to be anchored on law. And that is why we need to have it at that level. On a lower level, the national policies and acts are normally customized by counties. They develop it, and also they have 2% as what they call contingency funds.
A process that has been slow for counties that experience perennial losses from climate-induced disasters. But if the laws are passed and implemented, it may change the narrative for millions affected annually.
Now, those are the discussions that have been going on here in Garissa in the past 3 days, and it will culminate in this panel discussion that we'll be having from this moment. But as I said earlier, Miriam Nyambura is here with us, and she'll be engaging other community members on some of the early warning signs that they are able to identify whenever a disaster is in the offing. Miriam.
That's right, Mashirima. Well, indeed, here is the audience right here from the 7 different counties that Mashirima mentioned earlier. And I'll be speaking to the representatives here who will tell us that particular discussion by Mohamed Dulo, who is from Tana River County, on the traditional warning signs. What are some of the warning signs that these other counties look out for? And perhaps I start off with Mohamed Halif. Mohamed, perhaps kindly stand as we have this discussion. Perhaps you tell us what are some of the early warning signs, traditional signs that you look out for.
Thank you very much, Miriam. I mean, we just used to do our own weather focus. We used to look at the moon, and when you see a ring round the moon, you know that rain is going to be enhanced. And if you look at the stars now, when you start the arrangements of the stars, the constellation, you will start knowing that these stars are actually, the rain is going to be depressed. It's not going to be actually, or rather moderate. We had our own ways of doing things. My grandfather could actually, in a point, describe the exact kind of rain we're going to get. We had scouts. You know, you will look at the Nimbus cloud out there, and he'll tell you that Nimbus cloud is 10 kilometers from here. He would send scouts, and would be able to save all the cattle, goats and everything else, until science came and started telling us about the standard precipitation index. You know, there was a lot of Kenya Meteorological Department, and this confusion has actually taken us up. But we were there. Pastoralism survived. Our cattle, goats, and camels were surviving. We don't even have a policy on some of these things. So it's only God who used to help us. People used to say pastoralism is going to die. It won't die. It's here to stay. The only problem we have now is the unfortunate thing of what you call climate change. So in Garissa, we have flash floods. The next thing is drought, and nobody is taking care. I wish my grandfather was alive. He would actually tell us, leave this place, that's where rain is going to come, just by looking at the stars. And he was doing what you call pinpoint accuracy. Thank you very much, Miriam, for giving me this opportunity. But we used to look at the stars. We used to look at the moon if you find a ring. And then certain, you know, the acacia the acacia tree, it used to have what you call flowers, preparing itself for the oncoming rain. We were so accurate, we were so fine, and we had our own scouts who would go and look at the nimbus cloud, which is heavy with rain, and he would know where to take the cattle. Unfortunately, science came in and destroyed everything of ours with what you call climate change. Thank you very much.
Thank you.
Thank you so much for the great insights. I'll also be speaking to Aden Shidau Dama, who's also from Garissa County, just to shed more light or give us insights into this particular, or talk about the traditional signs. Perhaps maybe just tell us briefly what are some of the traditional signs that you look out for?
And thank you very much, Miriam. My name is Aden Shidau Dama. I come from Garissa County, Lower Tara. Busy. And actually, we had our predictions, as my friend said before me. I don't want to repeat that, but and I want to add a little bit of some difference. And we placed their placements, seasons had placements, like months, or I mean days. This year, we time it as Wednesday, Tuesday. So Tuesday, 8 years, the other Tuesday that passed was 8 years ago. So we have placements of they come in a cycle of 5 years, and 8 years, 10 years, and 40 years. And you might see a season that comes around in that cycle of 5 years. You say, the elders will tell you, or those who had that period will tell you, we had such a period, or rainfall or drought in 5 years' time. Somebody might tell you we had a drought of such a magnitude in an 8 years' time. That is, this Tuesday, the other Tuesday was 8 years ago. And it might come a time when you might not see that season for a period of 40 years. Anybody who had the luck of coming that time will tell you, my son was born or my daughter was born at that time when this season was such and such, and happened this and this way. And having said that, as my friend said, and these periods are not now reliable because of climate change, and things are not happening the way they were. We have recurrent floods, we have recurrent floods and droughts. So the predictions we had before that were accurate are not so much reliable now because of this climate change. It had been interfered with. So we urge all the stakeholders that are concerned not to depend on predictions of our fathers or our forefathers, and look for this what do we call modern, I'm not what do we call? Yeah, this modern way of predicting and the preparedness to save lives and humans and humanity. Thank you very much.
Thank you, Shidau, for that. Perhaps those are great insights, looking at the traditional warning signs. And maybe right now, we all know that the Kenya Meteorological Department actually today released details into the seasonal forecast for the months of October, November, and December. Perhaps I engage one of the officials from the Kenya Met Department who will give us insights into what this means for Kenya moving forward. And perhaps Julius Kimayo, maybe you just get right into it. Tell us, what does this mean for Kenya now that the Kenya Met Department has issued this particular seasonal forecast?
Kenya Meteorological Department is the authority matters weather and climate. The director has released our weather forecast, the national weather forecast today. Immediately the weather forecast is released, the county directors will customize or downscale the forecast to their counties, call stakeholders, including partners, sector heads, develop advisories, package those advisories into brochures, into talk shows, involve the media, including the radio stations, FM stations, disseminate the weather, the early warning information for early action for effective and timely planning. That's exactly what KMD does. So immediately the director, like he did today, the county directors like me, I'm the county director, Samburu County. Yeah, we will move in and do act immediately to prepare the public. Thank you.
That's right, Mashirima. Well, indeed, it's going to be an interactive discussion with the panel or as well as the audience here. And I don't know if I can take it back to you, Mashirima. You tell us perhaps what are some of the after-action review or lessons, given that this discussion is coming to an end today?
Thank you, Marianne. And indeed, that's a discussion that we want to pick it up from the representative from Garissa County. We've heard what the Kenya Med Department has said and also what the elders from Garissa County have also been able to mention. Once you receive this information from the directorates of the Kenya Med Department in your county, what kind of actions do you put in place to ensure that if there's a disaster in the offing, then you reduce the risks and losses that may be incurred?
Thank you very much, Kabombe. What we usually do is that once the Met Department give us the updates, we call immediately for emergency meetings, and that is the early warning, early action from the Department of Met. So what we do is that we call for emergency meeting and through the CSG, and that is where information on discussed from at the CSG level. Then at the CSG level, that is where we call this is the collaboration, coordination, and communication on issues on disaster is done. This is chaired by the governor and co-chaired by the county commissioner. This is where we have all our partners. And then from that, the Met will going to give whether the rains are enhanced, whether we have rains below normal, and from there we're going to separate ourselves, and then we go up to the technical working groups. From the technical working groups, for Garissa, what we do is that we do participatory scenario planning. In this participatory scenario planning, this is where the technical directors are going to have a meeting, and then we invite the people with indigenous knowledge. Then we also engage other stakeholders, private sectors in that meeting for planning purposes. So immediately we do that in the participatory scenario planning. That is where we give different department gives advisories, and then through that advisories we disseminate that advisories to the relevant through the sub-counties CSG teams, and then through the relevant department. On the same, we activate our contingency plan. If we have a plan, what we do is that we start activating now two things. We have the county emergency operation plan, then we have the county contingency plan, and then we have the world disaster risk plans. So we all activate all those plans. Then the other thing we activate is that we have the county emergency operation center. We also engage the we also activate the county emergency operations center. This is a coordination center where we're going to coordinate all our emergency in the Garissa County. So that is, and this one happens across, especially on all ASAL's counties currently. That is what we do.
And how effective have these measures been? Because when you explain them, it sounds like a dream, but when a disaster comes, it's a totally different story.
Thank you very much. It is not a totally different story. I have been working with Kenya Red Cross in 2015, and we had the Garissa University attack. And this Department of Special Program was not in place by that time, but there was no coordination. Haphazardly, all agencies were responding to the Garissa University attack. Later on in Garissa, the Special Program Department with the Donor Coordination Department also, and the Intergovernmental were formed. And that is where we had several emergencies, including the 2018 drought and emergency floods that has displaced more than, I think, 50,000 people in Garissa. And then we have the 2019, 2020, 2021 droughts. And through these departments, we were able to contain, and using our partners, we were able to respond very swiftly, including WFP, Kenya Red Cross, even UNHCR, and we have all our local partners responding to that. And this one, how effective it is that a drought of 3 years, if you check the number of children went malnourished, the number of livestock lost, the number of life lost, the migration pattern, it has totally reduced, and we were able to contain both the drought and also the floods. One thing that we have two types of drought, we have two types of emergencies and terms of disasters. We have slow onset disasters, and then we have the rapid onset disasters. So our planning depends what type of disaster we are responding to. And I can tell you that in the coordination aspect of our departments in ASAL areas have been very effectively and has reduced in terms of the number of injured, the number of death, the mortality, the morbidity has reduced totally from around 80%, and currently we are dealing with the disaster effectively at the county levels.
Thank you so much, Mohammed. Abarea, from the county of Tana River, whenever these warnings are given, how does the community respond? And I believe when the warnings are given, it's about a hazard, but then it turns into a disaster. So is it that the community does not take action, or it's the stakeholders, starting with county government and national government, that do not act early?
Thank you very much, Mashirima. For the case of Tana River, as a county, we are always in a cyclic, emergencies, whether it's drought or floods. And most of the times, we have the communities at the center of our operations planning, so that if effectively we communicate to them, they were part of the society, the planning process, so they can understand better when we tell them that maybe, for instance, move from point A to higher grounds. They can understand it better. As a society and an organization, we've started focusing more on resilience building programs and integrating some of these early warning, community early warning systems into our programs for effective management of these disasters. So yes, community is very important, and if we involve them from the planning stage and design, they can understand better and respond better to most of these emergencies. Yeah.
Can you give an example of a recent coordinated effort that then involve the community and the losses were much lower than what was there in the past?
We just had floods like a month ago, and one of the lessons that we've learned from that is, due to the effective community structure that is in place in Tana River, the community-based DRR teams, we have around 5 of them in Tana River. Information about even the river flow was better managed than before. So you'd realize that maybe maji ikifika hapa Madogo, Bua, is it Bua? The one before Madogo. The community CMDRRs make calls to Hola and even Tana Delta, alerting the people, telling them, maji imepita, Bua, na the magnitude of the flood water has increased. And this has really helped us. For instance, we lost around 8 lives this time, casualties due to the floods. That is a reduced number based on previous experiences that we have. So yes, these systems work, and it's practical in our area, and we can start to see the fruits of them in the county.
Okay. Nyatuga, you're from WFP. Perhaps you can talk to us about
Garissa County has played host to 7 counties positioned in arid and semi-arid lands for a discussion that is in line with climatic seasons that bring out hazards that more often turn to disasters.
And we have a lot to do when we get back to our counties.
The 3-day workshop led by the Garissa and Isiolo Humanitarian Hubs under the theme Enhancing Disaster Preparedness Response, Recovery and Resilience in Kenya's ASALs brought to the fore early warning systems used by communities and governments.
Tunatabiri na nyota. Kuna nyota ambazo zikionekana, hizo nyota huwa zinaelezea kwamba mwaka huu kutakuwa na mafuriko. Vile vile tunamesha hizi mawingu. Mawingu kama yatakuwa yanatanda, alafu hayanyeshi upande huu wetu, yanakuwa yanapita, huwa tunajua tu nyanja za juu kutanyesha na mafuriko yanaweza kuja kwa wingi. Na vile vile joto likiwa lingi sana na kuwa ni namna hiyo, tunajua tu kuna mafuriko. Bado huwa tunaangalia ndege. Kuna ndege huwa wanahama kutoka sehemu zingine wakija sehemu zingine. Sasa ndege kama hawa tukiwaona kwa wingi wakifuatana, wakipeperuka kwa chini wakifuata mtotana, tunajua tu kwa wametoka upande wa juu wanaenda upande hii, tunajua obvious hapo kuna mafuriko yatakuja.
The Kenya
Asante sana kwa kuendelea kuwa nasi. Tunaomba radhi kwamba Asante sana kwa kuendelea kuwa nasi. Tunaomba radhi kwa matatizo hayo kidogo ya mawasiliano. Tunakuletea matangazo haya mubashara kutoka kaunti ya Garissa. Na kwa kweli nilikuwa natarajia kwamba kutakuwa na joto, lakini hivi sasa kunanyesha, ndio maana stima zimepotea kidogo. Lakini tulikuwa tunazungumzia masuala kadha wa kadha kuhusiana na tahadhari zinazotolewa wakati majanga yanapotokea, pamoja na zile taarifa ambazo zinatolewa mapema. And as I mentioned earlier, this conversation is both in English and Kiswahili. And just before we lost communication, we were speaking to Bernard Nyatuga, who's the Program Policy Officer from WFP, who was talking to us about the interventions that WFP makes and the approach that they take whenever a disaster occurs. Bernard.
Okay, thank you, Mashirima, and also grateful that I'm in front of the audience. Indeed, WFP has presence in all the counties that you had mentioned. And picking from where the earlier speakers left, we talked about the advisories that are given by Kenya Met and also the various government arms and partners who are involved when it comes to response. So ahead of response, for WFP, how we've seen the landscape evolve is that we need to invest, first of all, in the institutions that are responsible, both at community level and also government and other partners. And when I talk about that, when investing in institutions, first of all, we need to understand policies that exist. I think one of them said that there are no policies, and that is with regards to early warning information dissemination. From the Met release, it's a participatory process where you have both the people who generate the information plus the users, and there's consensus building on whether this information is helpful. For WFP, our focus has been more in looking at how do we invest also in the government institutions to ensure that these predictions are reliable, they come on a timely manner, and they can be used according to the situation that people are in. So indeed, at the moment as we speak, we are also engaged with Kenya Met at the national level, and this hopefully should be cascaded to county, where we are looking at investing in modeling that can also ensure the accuracy of this information that is shared. Because for WFP, food security and human life, saving human life as well as livelihood is quite critical. The other aspect is in terms of systems. We talk about information management system. Before a hazard or a disaster materializes, you need to know who are the most likely to be affected. So within WFP, we've also invested in different government departments to ensure that we have information management systems that can have the names and profiles of those who are likely to be affected. This helps in a disaster situation so that you can access this information without struggling to start a registration process. There's what we call enhancing registry. Some of you may be aware of that. It is hosted by the Social Protection Secretariat, but it is accessible to all across different sectors, more to ensure that we are prepared to be shock responsive as it happens. And lastly, many people talked about actions that are there, and you asked about practicality. One of the challenge is that we will have the actions that are recommended, for example, preposition of supplies, having health supplies available. But if you don't have resources that have been pre-arranged, it means you cannot act as fast as possible. So for WFP, internally we have a mechanism that allows us to tap into resources on climate financing, which at the moment we are piloting with Marsabit and Wajir County. And hopefully, if the triggers that have been issued by Kenya Met hit the threshold, then we are able to access that funding and practically demonstrate that you can act prior to a disaster.
Talk to us about these pre-agreed plans with government, whether it's county and national, that have led to a successful intervention. Because as I understand, whenever a hazard or a disaster occurs, then organizations such as yours cannot take the first step. County and national government have to sort of ignite the vehicle before you all get on board.
Indeed, you're right, and we are here under the invitation of the government. So for all processes that I mentioned, it's the government that takes lead. And as we speak, those pre-agreed plans are with specifically Marsabit and Wajir County, the ones I gave an example of. But beyond that, when it comes to nutrition interventions that were mentioned by my other colleagues here, those are also with other counties. And indeed, as we speak, for all those counties that I've mentioned, there are agreements that we've negotiated with them so that we expound on what WFP can do and what the county can do. And this is also helpful when it comes to resources, because if we don't agree on putting resources, then it means we may struggle at some point to address some of these interventions.
Okay. Samuel, you're from Save the Children, so definitely your priority is on the well-being of the children whenever there are these disasters that occur. Talk to us about what are the areas that you focus on, and what are the specifics in terms of making sure that the needs of children are prioritized whenever a disaster occurs.
Thank you. Moses, not Samuel.
Moses, sorry.
So Save the Children is a child rights focused organization. And so all our work, we think about the child as the center of what we do. So in Kenya, our work cuts across the different arid and semi-arid counties, some of whom we are represented here. And our programs look at both long-term development as well as humanitarian work. Experience has shown us that when a disaster happens, children are among the most affected people. When floods happen, it's children who cannot go to school because the schools are destroyed, their learning materials are swept away, or the school compound is flooded. And quite often, children are not part of the conversation when we think about either preparedness or response. For instance, you look at many disasters, immediately a disaster happens, and numbers of people affected released, you hardly hear about number of children affected. So it comes after afterthought. On the contrary, it's actually the children who are most affected. So part of the work that we do is to really raise the voices of children. So what we do is to talk to children around different disasters, create memorandum of understanding with the children, and we use these particular voices to influence some of the policies and response plans that are put in place. We have instances where we've also done conversation with children, and we use what we've said as an input in the county integrated development plan, and some counties have actually considered the inputs that they put in place. Our programs, for instance, we try and look at where the children are most affected. For instance, when we do nutrition program, we want to look at malnutrition is one of the risks that face children in a food insecurity disaster, for instance. And so we want to focus on where the children are. What services do they need, and how can we make the services closer to them? The children face protection risks, so we work with the government agencies and other stakeholders to ensure that these services are available for them. Young girls face gender-based violence, sexual offenses, and all these are risks that face to them. So we ensure that the services are available for them to be able to protect themselves, but also support them to recover from any disasters that happen. Thank you.
Give us specifics, especially with the flooding that has occurred in the month of April, May, more so in Tana River and Garissa, when a lot of the schools then were flooded and these kids were not going to school. How does Save the Children come in when it comes to the education sector?
Thank you. We don't have presence in Tana River, but we do have a presence in Garissa. So once, together with our stakeholders and the county government, assessment are done, we want to prioritize the issues that affect children. We want to prioritize the households that have the burden of children that are displaced. And for these floods, for instance, one of the things we did immediately after the floods is to work with the government and stakeholders to ensure that those households with children who are displaced receive cash assistance. This cash assistance is for them to buy food, it's for them to buy materials, it's for them to also seek health care where they have to pay. So we do really prioritize the households that children are part of it. Thank you.
Thank you. Mohammed, perhaps you can add some more insights on the kind of partnerships that you have as county governments with organizations such as UNICEF, Save the Children, WFP, Kenya Red Cross, Oxfam, and others that are represented here.
Thank you very much. We have a close partnership with most of the organizations in this place. And this is, we have an MOU with most partners who are operating within Garissa. And currently we are developing also a partnership and donor and partnership coordination policy to strengthen the collaboration and coordination in our county. So far we have around 40 organizations working in Garissa, and then we have another 20 active in the DAP. That makes around closely very active, around 60 organizations working closely. And this is currently being coordinated. In terms of DRM, we have the disaster risk management policy that coordinates, and then we have the county disaster committee at the brass level or the county level. So through that coordination arm, we are able to coordinate closely with these organizations. The different organizations, for example, I just wanted to pick from where Save the Children. Save the Children are one of the organizations that have done focus-based financing in the last, for example, like the last floods. They were able to give around 300 households, 69,000. Immediately we had the first flash flood in the first. So they were able to give around 69,000 shillings to 300 households. And these households were able to rent house. They were able to take their children to schools. And they were slowly evacuating from the riverbanks to town. We have close collaborations with Kenya Red Cross. We're working closely day to day with Kenya Red Cross. Kenya Red Cross being a lead partner in terms of emergency. So we are working closely with Kenya Red Cross in terms of emergency response, preparedness, response, mitigation, and even the recovery level. We have international organizations like WHO. We are collaborating on issues on diseases and surveillance in terms of diseases. We have UNICEF who are working entirely in all our departments. They are working on WASH. They are working, supporting us in terms of, UNICEF are supporting us in terms of health, nutrition. So we are closely working with all partners. We have local organizations like FAIDA, PGI, and RRDO working closely in terms of during drought. And so in terms of organizations, we have a Department of Donor Coordination and a special program coordinating their efforts through the County Commissioner's Office. Then we are still working with the private sector. For example, like in the OND rains, we have a problem. We are not able to at least alert the communities in terms of fuel. So what happened is that the road were cut off, and then we had fuel crisis, and then there was the issue on now hoarding came, and then there is prices of food shoot up. So what happened is that in the MAM rains, we learned from the lesson learned from the OND. We were able to meet all the petrol stations in Garissa. So immediately we got that there is El Nino, the enhanced rains. We were able to discuss with all the people, all suppliers of fuel. So in the March, April, May, we never had such a problem. So we were able also to sensitize communities in the market so that at least they were able to pre-position food and both fresh food and the normal food. So that is the partnership, the type of partnership we are doing with the private sector. We have a very strong collaboration with the NGOs, both the locals and the international NGOs in terms of disaster reduction. We have both the short term and the long term. For example, like we have most of these organizations are doing resilience projects, a climate smart project. They are doing, for example, like dryland irrigations, because we are losing our animals. We have the cyclic drought. So one thing that our partners are supporting us, and also our county government is embracing, is that a system where we want to have a resilient project by the county government. And then we are trying to embrace to tell our counties that we should have a system whereby we should have a joint proposal development, a joint implementation, and then a joint monitoring in terms of either disaster, short-term or long-term projects. Thank you.
Roba, what Mohammed is talking about is specific to Garissa, and perhaps this is a question that both Bernard and Moses can also weigh in on. Are there standard operating procedures across counties on what to do when a disaster occurs?
Thank you, Mashirima. I think I can speak to Tana River County. Yes, we do have, but they're not enough. We have the DRM policy that is still at draft stage at the national government, but we have a copy at the county where they try to strengthen, especially the coordination aspect on what do we do when, for instance, a drought comes. And it's quite elaborate, effective, but the challenge comes with implementation of it. And that is where I think as partners, we need to come out clearly and work collaboratively in trying to realize the value of that. For instance, in Tana River, we have an emergency operations center that ideally is supposed to coordinate all emergency response in the county. But we still have challenges. We are not, I feel we are not using that facility well enough, and it would really strengthen most of our response capacity as a county if we come together as partners and make use of such a facility. So yes, but they are not enough.
I'll start with Moses, because he was nodding aggressively as you were speaking. What do those standard operating procedures look like in the counties where Save the Children has a presence?
Yeah, first of all is to say a lot of work has gone into developing standard operating procedures from the Emergency Operation Center, evacuation SOPs. There are quite a number of them that have been developed. And then thanks to all stakeholders, including the government, that have developed these particular SOPs. I think the challenge is how we, just what my colleague mentioned, how we turn around these SOPs into real action. For instance, some of the SOPs that have been developed require immediate financing when a disaster happens. Sadly, when that happens, we really have to, and county government, national government, we have to run around to look for funds. And in that case, we have delays in implementing some of the actions that we thought about. So they are good work done, but there's still more to be done, especially on the financing part, because a lot of those depend on the financing part. The coordination is good. And looking at what has happened even with the last rain seasons, you see a lot of improvement in coordination, a lot of improvement in what my colleague mentioned, how do we involve private sector, the logistics, all those and partners. So that is well done. But there is a bit of financing that is required in some of those SOPs, and that is still a gap. Thank you.
Bernard?
Yeah, thanks, Mashirima. I was listening to colleagues here. One arm of the government that we are on level is the national government. And when it comes to disaster risk management, it's a co-shared function. So if we don't speak collectively between county, national, sometimes we may lose it. And when we talk about standards, because standards may go beyond just one county and to the next one.
Yeah.
So there are a few guidances that have been developed by the National Disaster Operations Center, and I believe I had two counties that have talked about county emergency operation plans, and that also provides for the county emergency operation centers and other SOPs for coordination, communication, and all that. So there are counties where this has been rolled out, embraced by the counties, and some of the partners, and from the UN side, I'll speak that we work around what we call a cooperation framework that brings different UN agencies, UNICEF, WFP, UNDP, because we have different comparative advantages of strength that we bring into this. So if there's still a gap in other counties that may have been missed out, I believe this is an opportunity to ensure that this is cascaded across all counties so that we have a unified way where they can customize this county emergency operations plans that were developed at national level. And these may also come into play when we speak about the disaster risk management bill, because that also has provisions for that in terms of how that needs to be executed and how support can be provided by, to both national and county governments.
And I'm glad you mentioned the National Disaster Risk Management Bill that still remains a bill, but there are conversations that have been going on. Is there light at the end of the tunnel? Will we have it passed as an act in the next few, say, months before the next disaster happens?
That's to me?
Yes, and to all of you actually, because
Okay,
I'm sure you have been participating in the public participation and giving views on how that can be enhanced.
Yeah, I will pick it up because when we had the El Nino, we did have an after-action review immediately. And at that time, we had commitment from Interior, this PS Interior, that they would fast-track, working with Parliament to fast-track the enactment of that bill. And indeed, from the UN side, and also with Kenya Red Cross, we had also other partners who were part of it. We did develop some memo that we also shared with the parliamentarians to lobby that for them to see the essence of ensuring this is passed. So as we speak, I believe it has gone through Parliament, the National Assembly. It is at the Senate. And from the UN side and also other partners, we were working towards also sensitizing the members of Senate to see the essence of passing the bill as it is, because what we realized, there are small contentious issues that would come up and that takes it back. So I'm hopeful that once it goes through Senate, then it will give us legislation that would support some of these proposed interventions.
And I can imagine, Mohammed, this is a bill that has also been replicated in the counties. There are other processes that are going on in the county assemblies that are similar. Talk to us about the challenge of not having that bill enacted and the aspect of funding.
I think most counties, especially the ASAL counties, they have a DRM policy and then they have the DRM bill. And there is the issue on the public participation, especially on that bill itself. And it's like a duplication of efforts because counties have currently their own bills and they have their own policies in terms of the county assembly have passed. So for me, there is the conflict that will come from that bill is that there is no public participation at the counties level. Counties, they are doing their own bills and they have done it so far. They passed and they have also, they also, actually, the assembly have passed. So that means...
That's for Garissa?
Yes, for Garissa. We have for Garissa, for Tana River, and I think even Wajir, they have passed it, and Mandera. So, and without consultation at the national level, they are just doing, they are doing another bill. The bill is ongoing. So now there's a conflict of which bill now. Because the national level, they are supposed to come down, at least know what is going on at the county level. And then from that discussion, they were supposed to pick the good part of the county, and then they were supposed to do a proper public participation. But for me, I actually saw it, that one, the National Assembly discussing and currently forwarded to the Senate without the input of the 47 counties. And that's a contentious issue for me. And it will going to bring an issue at the county level, and in terms of implementation, it will not be a proper one. Because he who wears the shoes knows where it pinches.
So why don't you people talk to each other as national and county government?
So
what's the problem there?
We have a coordination. For example, like currently we have the coordination for all the 47 directors for directorates. And we have, we were able to, at least through the Council of Governors, we were able to echo our concerns to the Council of Governors, because we have a focal person for Council of Governors for the 47 DRM directorates. So we have that concern, and it is raised at the national level, and I am sure it will going to reach both the Senate and the National Assembly. So, but there is an issue that needs to trickle down and discuss at the county level before enacting that one into law. Thank you.
Moses.
The question of the importance of
that legal framework
at the county level. When a disaster happens, there are three critical elements for us to respond effectively to save lives. One of them is coordination, which we've mentioned a couple of times through the workshop this week. The second one is financing. And the third one is an element of decision making. The DRM bills, if passed, provide the legal instruments for all these elements to be well executed. It defines how coordination is supposed to be done at different levels of governance, county, sub-county, and even ward level, and also defines representation within those particular committees. If those committees are well anchored on law, they have the power and they know when to make the decision in terms of response, and they're able to articulate the needs of the people affected in the different communities. The second element is financing. One of the biggest challenge with disaster responses in Kenya is financing. And one of the gaps with financing is the legal instruments that give colleagues who are either in national government or county governments the power to make decisions on allocating budgets for response. If we have this bill passed, then colleagues who are in the county government have the framework within which they can make a decision. Different counties have taken different routes in terms of articulating financing in those particular bills. Some say 10%, some say different values. Most important is there is a legal framework for you to allocate some money that you can tap into quickly when a disaster happens. And then finally is the decision in terms of the command center. I think those are the three elements that this law is quite important that would help us with. Thank you.
You say 10%. These past 2 days I've been hearing 2%. And I don't know how that works, Roba. From the perspective of Kenya Red Cross, these percentages that are being thrown around, is it money that is enough to deal with the hazards that then turn to disasters?
Well, to pick it up from where Samuel has left it.
Moses.
Oh, Moses, sorry, bro. Moses, for instance, for Tana River, it's at 2%, right? Clearly, it's not enough. Secondly, it's the last mile part of it. Yes, Kenya Red Cross is supporting the government in, pushing for the bill, and we are almost at the validation stage of it. Have we prepositioned our counties well to disseminate those bills and try integrate them into the existing bills at the county level? Have we done that? For instance, Kenya Red Cross, through the support of ECHO, we have Tana River, Garissa, and Turkana well prepositioned, ready for the bills, and both for advocacy and dissemination of the bills. Are we ready with the other counties as well? So it still comes back to financing what is said. So it's clearly not enough, and it needs harmonization across board. And I think that is where now the national bill really matters in guiding now the county level bills. Yeah.
Bernard?
Yeah, interesting conversation. I won't talk about public participation because, again, we need to be clear what public participation means. Because I've participated in a number of the county level policies and bills, as well as the conversation at national level, why it couldn't move forward. One of the contentious issues was about involvement of the public. And if you read the Hansard, you will see that discussed. So I would encourage people to access what is in the Kenya Law Reform website and read what has come from different counties so that we also don't become an impediment when it comes to moving the processes forward. In fact, for me, the biggest win there would be to have a body or an institution that is able to coordinate matters to do with disasters. Because that's a weakness that we acknowledged when we were here, not only at county, but also county, national level, and we saw it during the floods response. Yeah, so I would encourage us that we look at the pros or the pluses within those legislation. It never be 100%. The 2% is also provided for in the PFM, the Public Finance Management Act. I agree it is not enough, but it's for us to generate evidence to argue our case that we need to allocate more than that so that it is provided for within the law. If it's provided for, then that galvanizes that money to be accessible. And then lastly is the evidence that is generated for us to access that money. Because if we say we are setting 2%, how do we access it? We need to have thresholds that would define that we reach this threshold, that's why that money was released. I think that's why we have a struggle and we need to generate evidence for that.
And when we talk about that 2% or whatever percent that would be agreed upon, Mohammed, what does this 2% do? And what's that threshold that Bernard is talking about?
Well, there are two. They have the 2% that on the PFM, that is for emergency, and that is just immediately we have an emergency, that's for response. But the 2% we are talking about is the 2% that we can use for preparedness, early warning, early actions, and it's starting from the mitigation, preparedness, and the likes. And then we can use the 2% still on the recovery. But the 2% currently we have is the 2% for emergency in the PFM Act. So there are 2%. We have the 2% in the PFM, and then the 2% we are anchoring in the DRMs in the respective counties. So what we use for the 2% for the DRM policy, this is where we want to build the community resilience. We want to do the community training. We want to train also the key respondents in terms of emergency respondents. We want to have the structures formed at the community level, and then we want to reach the community. So that is the 2% we are looking for. And then we want to have projects that are looking in terms of resilience and the creation of community resilience. Then we want to have an early action, early warning systems that will strengthen the systems we have. Then in that 2% will also support the institutional support. Once we have logistic support, we have the human resource with our capacity, and then we have those are the things where we need, because an institutional, for example, is like if we have a strengthened institution with human resource, with logistics, with capacity, they can able to respond. Then we have infrastructure development. We have an EOC. We have stores for example, warehouses. And then we have vehicles that we can transport these relief foods to the community. So that is the type of infrastructure we want. So that is the 2% we are looking for. Instead of just waiting for example, like a whole year waiting for disaster. You can have that year, the whole, for example, like let's say a whole year without a disaster. What will you do? The department will going to concentrate on resilience building to the community, including the capacity building of the community. So that's why we are trying to look at the issue on community resilience building. So the 2% will do that.
Okay. Roba, talk to us about the threshold for an emergency. What determines what is an emergency?
Well, I think there are different thresholds for different emergencies. In our context, mostly is floods and drought. So one, for instance, is the displacement. Where, like Tana River, always we are the last mile county in terms of emergencies. So one of the key indicators for us is the number of houses displaced. It forms into the magnitude of the emergency we're in. The others around maybe livestock, our trekking distances for animals and people factor into that, as one of the indicators for an emergency in our area. Yeah.
As we move forward to Bernard, talk to us about resilience, because Mohammed has mentioned that whenever a flood occurs, last year the floods November, December, and then after the floods receded, then there are people who went back. What plans are in place to ensure that communities move permanently from those areas that are prone to the floods and the droughts? How do you build that resilience after recovery?
Okay, thanks, Mashirima. That's a complex question. And I'm looking at it between linking humanitarian support, resilience building, and the development work. To a large extent, we tend to focus more on the humanitarian, which is short term. Yeah. And once that is done, then we miss the other steps. So in terms of design, for WFP, as I mentioned earlier, we are looking at it even before the disaster strikes, so that we have pre-agreed actions and even financing. This is not easy, even for decision makers, especially the politicians who are in the leadership, because you need to convince them that you have evidence to show that you are not putting in money that will be lost. Secondly, the same people, where we call them hotspots, the areas that are prone to disasters do have people who are more vulnerable, others who may bounce back quicker because of the kind of investments that they have. So it's more about integrated programming. And from a WFP perspective, I talked about the enhancing registry, where you'll have data for everybody. Because as we sit here, in case there's a calamity here, it will choose who it lands on. Any of us can become vulnerable as we speak. Yeah. So we need to link all these programs, social protection, especially for the older people. We have people with disability, because they'll be more vulnerable when we have a disaster. Mm-hmm. Such programs need to link also with other programs that support nutrition for mothers who are breastfeeding and children. And then lastly, there are investments when it comes to resilience building. It's not only to ensure the well-being of people, also tapping into the local resources. We've been having conversation. We have a lot of sun, solar energy. I think we are working closely with a number of counties. The resources that are required for that, especially for water pumping using solar, is a lot. But we can demonstrate from WFP, we've had small investments which can be replicated. So that's what we are encouraging, and that's a kind of practical conversation we've had with the colleagues from the different counties, that let's invest in what is available locally, both in terms of the resources as well as the people's capacity. We do have small investment schemes. We call them village savings and loans associations. These are working quite a bit, and they are structured. So if we can invest in capacitating these communities, as well as providing grants that can help enhance their capacity to stand on their own, that is better than providing relief, which is short-term and we may not be able to sustain. The complexity that I brought here is about land ownership, especially in this region. Because when people are displaced, and it's a conversation that came up at some point, I wouldn't want to go back to that. If people are displaced and you want them to move, and we are saying they move to somewhere where they can sustain themselves, it requires joint effort also with the county leadership and both the county government and national government to identify areas that people can be relocated, and then they can sustain their lives there. And if there is a mechanism to ensure that that is workable, then that's what we should be looking at in the long term. Thank you.
Okay, and this conversation is also going on online with the hashtag Early Action in ASALs, and we're about to wrap up, but I would like to get some final remarks. Perhaps, Robert, you had something to say?
Yeah, I just wanted to add one thing. As a county in Tana River, one of the lessons learned, and there's a program in the county that's called Village Cluster Program, which is a form of an innovation on how we can now for sustainability reasons. It's a very ambitious program, and we believe that if supported well and executed well, can be an answer to these perennial flood emergencies. It's a program that addresses those who live along the floodplains being moved to higher grounds, together with their social amenities, schools, houses, and all that, and then they be left behind to do their livelihood activities. So that when floods come, it becomes easier for them to move out and avert disasters. Yeah. So it's a very ambitious program, but it needs serious financing and legal backing. I understand the county government on their part are trying as well to come up with the relevant supportive legal framework. And that is where we need partners and financing for such models that build resilience of communities.
Mm-hmm. Yeah. Moses, what does resilience look like to you at Save the Children?
So the idea about resilience is that you have a community, households that can able to cope effectively even when you have floods, when you have droughts, and any kind of shock that happens in this area. So, and livelihoods differs from community to community. We have communities, for example, what was mentioned here, who largely depend on livestock. We have communities who depend on agriculture. We have communities who depend on wages and earnings. So livelihoods is being able to withstand those shocks and still being able to meet your basic needs for you to survive.
Okay. Mohammed, what does resilience look like for you here in Garissa?
In terms of resilience means, as said by Moses, a community, when a community is exposed to either hazards, should it be a drought or floods, this community have all the mechanism to respond, and they have all the mechanism to withstand with all sort of emergencies or disaster that happens to them, and they can bounce back to their normal life immediately. Even if there's an emergency or there's a disaster, the day after, when they are affected, they can bounce back to their normal life. So that is a resilient community. And I wanted to give maybe the summary. For me is that for us to have such a resilient community, we need to engage community at the grassroots during development, all their development, including proposals. All their problems should come from the community, but not coming from partners, or should not come from the government. For example, Garissa, we have the climate, but we have done the participatory climate risk assessment, and we have formed committees. And through that, we are able to respond and do resilience project at the community level through the FLOCA, the climate change project that is financing locally led climate action projects. So that is the type of where we want to go as community, so that we develop the community resilience, and this problem should come from the community. And that is the community know their problem, and that is how we can address issues at the community level. And it should be a bottom approach system. Thank you.
Thank you. Bernard, you have the final word. There are all these plans, the community have their ideas on how they can build resilience, but financing is the elephant in the room. How do we address that as you give us your final word?
Okay, thank you. I would say that the world has become a small community, such that we do learn from each other. People from Garissa can learn from other counties, as well as people from the different counties can learn from other countries. So indeed, we have success stories from elsewhere that I would say, when we embrace the community action plans, where we have partnerships layering on the different initiatives, because the communities will come up with the ideas. Based on the lessons learned from elsewhere, we will say this has not worked because this environment seems similar to another one elsewhere. So that conversation helps us to agree what kind of initiatives can we layer from the community ideas, the government, other partners, so that we sort of, wanasema umoja ni nguvu. So one person, as much as you may want to invest, say Garissa alone, you will need the national government, you will need WFP, Kenya Red Cross. So if we pull together into what we may see from a WFP, we are calling them hubs, because we want to see whether that can be replicated. You talked about resources. It means whoever is coming there, you should be willing to put in resources. And from WFP's perspective, we are looking at sort of coming up with agreements, whether they are written or not written, but we have a commitment that for, say, 10 million shillings that we think if we invest, we'll ensure people access food, people access nutrition commodities, health, education. We do part of our bargain. So to a large extent is more of having a collective responsibility, county governments agreeing on some of this by signing off or committing, national government as well as other partners, so that we can work with communities to ensure that they are resilient.
Thank you very much. Bernard Nyatuga, who's the Program Policy Officer from WFP, which is the World Food Program. At the end there, we have Moses Emalu, who's from Save the Children. He's a humanitarian manager. And we've also had here on our panel, Abarea Roba, the County Coordinator for Kenya Red Cross in Tana River County. And last but not least, the Director of Special Programs, Donor Coordination and Partnerships in Garissa County, Mohamed Dubo. Na pia hapa tumekuwa na wakazi kutoka kaunti mbalimbali, kama nilivyotaja ni kaunti za Garissa, Isiolo, Tana River, Marsabit, Samburu, Mandera na Wajir, ambao wako hapa kwa hisani ya Asal Humanitarian Network kwa ushirikiano na mashirika mengine ya UNICEF, WFP, Save the Children, Workshop Fund by Australian Aid, ECHO and Oxfam in Kenya. And the discussions that we've been having here for the past 3 days are on disaster preparedness, response, recovery and resilience in Kenya's ASALs. This conversation continues here in Garissa, in the other counties that I have mentioned, and also online by using the hashtag Early Action in ASALs. Asante sana kwa kutazama. Nimekuwa na mwenzangu Marian Nyambura na atakuwa nakuletea taarifa ambayo aliandaa mapema kuhusiana na jinsi hali ilivyo haswa katika kaunti ya Garissa. Jinsi ambavyo jamii ambazo zimeathirika na mafuriko na majanga mengine zinavyoendelea na maisha. Naitwa Mashirima Kapombe na kutakia utazamaji mwema.